we're cutting right up to the end, but is there a mic for the questions you can pass around?
I'll do the best I can do this now.
Okay.
I thought the presentation was very, very interesting, and particularly thank you, particularly for someone like me who, understands these issues at a high level, but frankly am not engaged on a personal level in as many of these sort of social networking tools. But something I've never seen anybody address, and I have a theory about it, I'd really like to get your comments, is a lot of this is talking about, the relationship of the institution outward or the professor outward. But, I have a 15-year-old daughter, and I'm convinced when she's in the workplace, they're not using email because they don't use email now. And so I'm wondering your thoughts on what does the workplace look like in, let's say, 5 to 10 years? Because I use email exclusively and prolifically, and I don't think in 5 to 10 years anyone's going to be using email in the workplace. That sounds like a radical notion, but I'd like to get your comments on that.
Go ahead. Yeah, I hate email. Just sitting here, I probably got 80 emails in my inbox, and most of them are like where I'm copied on the subject line, and it's like, it's like, oh, okay, great, thanks for copying me and saying thanks. I don't need that. I think what we're going to see is employees they're already using these new tools, these new dynamic tools to communicate, collaborate, and do things in completely different ways. Conversations are changing. The way we work is changing. There's these huge concepts now about these enterprise social networks and being able to use tools like Yammer, Jive, or even the NAPH membership site is a really good example of how you can collaborate and share information in a different way. The other thing too is I'm seeing a lot of the tools are starting to all collapse down so that you post in one and it goes to many because people are using different tools to communicate. So I predict that that email will probably become an outdated way of communicating. Not as bad as faxes, although people still use fax, particularly doctors. But I think that it will still become outdated, and we'll start to see people communicate very real time, very live time through these tools. And of course, then we'll have to address the whole paying attention and staying on, not being interrupted all the time with these communications. Bob, what do you think?
Well, just the only thing I have to add, first of all, Chris is the expert on all communication, not me. I do medical education, and I do some genetics and stuff like that. But what I thought of when he was speaking was that I come down hard on physicians all the time. How many physicians are in here? Okay. If you follow my tweets, I'm often insulting physicians in healthcare. That may have come through a little bit in my presentation today. I love physicians. I need physicians. I'm like a father with a child. I lay down the law because I want physicians to be what I think they need to be. I love them, so I train them the way I would raise my own child. So whatever it takes to make a physician a better physician is what I want to do. If social media wasn't involved, I would never say anything about it. I'm so convinced it is. I'm a patient. So in particular for physicians or hospital personnel here, I'm a patient. I'm a chronic pain patient, spinal type things going on, and so I'm constantly in care. So I understand the empowered patient's view of this whole thing. And knowing from that angle, it might be something that perhaps physicians, especially those who are already in practice, just may not have a full appreciation for how empowered patients are today via social media. And they're not just empowered because they're talking to other people. They're empowered because information is out there and they can become experts on whatever is their trouble. So that's all I wanted to say. I'm not sure how well it related to the question, but I thought it was an important answer to give. Yep.
I just wanted to say thanks for a great presentation, and having heard this at a lot of other organizations' meetings. One of the coolest suggestions I've ever heard come out of a session like this is the concept of sort of an institution's leader almost asking for or finding a techno mentor, sort of a younger person in the organization that has a way to sort of create a mentoring relationship with a hospital or organization's leader in exchange for sort of teaching them how and why they use their social media tools. Because one of the things that I don't know, and one of the questions that I'd ask you is there an etiquette when you're sitting with sort of senior leaders at a lunch at a meeting like this, and you're excited because you're tweeting the Safety Net Awards, and yet you know in the back of your mind everyone around you is looking at you going, why aren't they paying attention to the conversation? Why are they on their BlackBerry incessantly? Is there a good etiquette way for kind of saying, I'm not ignoring, I'm broadcasting?
The thing that comes to my mind immediately was the three of us were at a Mayo Center for Social Media event in Jacksonville in March. And that was our first meeting, because this is all brand new. And it's on the Mayo campus in Jacksonville. And Lee Acey was there, and he was speaking. And I looked around the room. It might have been twice the size of this, with maybe 3 times as many people. And everybody had their heads down, just like we've been doing while each other. And so I asked him afterwards, does that bother you? And he said, not at all. He said it's a part of the game. He would expect it to be happening. And it's kind of interesting because in a situation like that, everybody was staring at the computer. Tweets were going out like crazy.
Mm-hmm. Yeah, well, and I've had that experience with sitting in the executive meeting tweeting. I wasn't tweeting what they were talking about. Heaven forbid I do that. But I was tweeting because I was interacting with a patient that was complaining about something and trying to steer him to a patient care manager. Hold on a second. So what I would say to them is, I am paying attention. I'm just, what I'm doing is I'm actually communicating in a different way to other people, and sometimes, what they're saying is important enough for me to share with other people. You have to be careful, though. Sometimes I have to show them, and I do realize I misspelled the word conversation, just so everybody on Twitter following. You have to share with them what's going on and showing them the back channel, like what's the back channel of the conversation. And at times they may call you out for being unattentive or inattentive, and you just have to indicate, that this is a new way that we're communicating, and show them your BlackBerry screen, show them what's going on. So, the worst thing you can do, though, is correct them and tell them that they're wrong, right? I hope my CEO is not watching, but he had a meeting with me once, and 3-hour meeting about how he wanted to Facebook. And really, what he really meant was to blog, and I didn't correct him the whole time. But, I mean, because I understood what he meant, and, I appreciate the fact that he actually wanted to do that. So I think that what you have to do is you kind of have to share with them how it works, so. You're welcome. Come on, you guys have questions. How do you get started? How many here are CEOs? Are you going to go open up access to all social media now?
It's not that what you presented wasn't compelling. It actually is. I actually really enjoyed this presentation. It's more, I've got to think strategically how the tools need to be used within the organization. And so I'd rather not start by just opening it up and creating mayhem. I'd rather start by focusing some attention about how to strategically integrate the tools. And I think the lesson learned from me, quite frankly, is that I got to do a lot more of that than I have. Because I'm not a personal user of these tools, and I probably need to start doing that. It's not that I can't. It's just that it's not part of my routine. but I think it needs to happen because it's clear where this is going, and I think you've outlined where it's heading correctly. So I think an element of a level of strategic thinking about its deployment, and then I think you loosen it up. I agree.
Yeah, I think so too. And legal, that's the worst. Legal and IT are the two worst, next to CEOs.
Other questions? Well, I just want to point out I have 2 mentors at NAPH that I could not do without. And one of them is Maya and the other one's Katie. So.
Well, a big thank you to you guys. You guys were great. I think everyone here enjoyed it. Another plug, please go out to the lobby area and check out the new NAPH member community. Go sign up, start talking to each other, find out what everyone else is doing on social media. Other NAPH members are heavily involved. There are great things going on from our membership. So thanks.
Thank you.
Thank you.